Welcome back to Main Street Living. It's Ladies' Day today. Danielle and I are holding down the fort. And Danielle, with so many things canceled this past year, weddings,
Mhm.
graduations, vacations, and probably your dentist appointment too.
It's funny you bring that up, Cheryl, because we have a dentist joining us today, Dr. Richard Masek. He practices near San Diego, California. He's here with some ways that you and your dentist can take care of your teeth and still keep you safe. So welcome to the show, Dr. Masek.
Oh, thank you very much. It's a pleasure to be here.
So, Dr. Masek, since the virus that causes COVID-19 can be spread through saliva, some people might think that going to the dentist sounds risky. Tell us, is it safe to go to the dentist?
Well, there's a lot of fear out there in just about everything these days. But dentists have been pros at doing infection control for quite some time, back to the early 1990s. And it's really a very safe environment to be in most dental offices anyway. We have a lot of protocols in place that have been routinely there since before COVID. And we all go through extensive training for OSHA and infection control as a condition of our licensure. So yes, it's typically fairly safe.
And I know you have those protocols in place, but what extra precautions have you been taking now due to COVID-19?
Well, the COVID-19 required that we, number one, do a questionnaire. So we go through a series of questions that we ask patients to make sure that they're healthy before they come into the office, so they're not going to be spreading anything. We also ask our patients to wear masks before coming in. We ask them to wait in their car before they come into the office, because we don't allow more than one patient at a time to come through the reception room, and we don't allow gathering in the reception room. We also do a no-touch temperature assessment, and we see fewer patients during the day than we typically did before.
So, Dr. Masek, you also came up with and patented a system to reduce the risk to patients and staff even more. What is that system?
Yes, during the COVID crisis, we were closed down for 3 months, and I didn't quite know what to do with myself. So I started looking around at different options to get us back in and make things safe. And I found some, but they weren't really solving the problems that I wanted to solve. So I created something that I call the Evade system. And the intent of it is to collect aerosols and process them and get them out of the office so that they don't spread throughout the office. But in addition to that, one of the other things I wanted to do is create a clean room environment, such as are done in laboratories. So I had my air conditioning people come in and put in a new blower system that injects fresh air from the outside into the hallways. And then we pull it through the treatment rooms and out of the treatment rooms with powered exhaust fans. And we actually turn the air over in the office 8 times per hour.
Oh my
So
God.
it makes a much cleaner environment for everybody.
It's like you have an airplane inside your dental office there with the clean air circulating over and over again. Why did you think all of this was necessary?
Well, COVID can be spread through various means, and one of those certainly is aerosols. That's why the mandates for the masks, depending upon how you feel about those things. But the aerosols still are transmitted and transmit pathogens. And one of the things that I really wanted to solve was not allow those pathogens to be recirculated in the office. Certain systems that I found that were already available would process the air. They would take the air in, they would process it with UV light and HEPA filtration and maybe carbon filters, but it would take that air and push it back into the room through the exhaust. And the exhaust was on the floor, which was blowing onto the floor and potentially churning up anything that settled to the floor. So I didn't really like that solution. And I've had central vacuum systems in my office for quite a while for carpet cleaning in my training center. And what I thought was, why don't I create a box that will filter, and then we pull all of that air and aerosols and eject it out of the building so that nothing is recirculated into the office.
Amazing.
And that's what created the Evade system.
Well, it's obvious that you prioritize health. And how important is it to continue to attend to your oral health even while the pandemic is still going on?
Well, it's extremely important. People don't like going to the dentist anyway, in general. And if there's an excuse that you can come up with, typically you're going to take it. But the problem is that teeth and gums are really the doorway to your body and your health. And if your gum tissue isn't healthy, if you've got overgrown bacterial things, you've got infections in your gum tissue or cavities, these things can affect your overall body health. And one of the things that has been really surfacing a lot during the pandemic is people do a lot of clenching and grinding because they're expressing their stress in their teeth. And I've had several patients who have come in who have literally broken teeth in half and had to have them extracted because of the grinding.
Well, I've cracked my teeth. They haven't had to be extracted, but yikes! I am
it's no fun, is it?
And a grinder. No, it's no fun. So I'm glad that you're shedding light on all of this, and we are about out of time. So where can our viewers go to learn more about everything you do and the Evade system?
I have a lot of information on my website and some videos, mysmile.com, and you can call 619-MY-SMILE to talk to anybody in my office.
All right. Well, thank you so much. We appreciate it.
I appreciate being here. Thank you so much.